Hi, Namaste. Welcome to Hum Tum discussion. Today we will see the next topic that comes under the neurodevelopmental disorder known as autism spectrum disorder. So our topic of discussion is autism spectrum disorder coded as 6A02 as per ICD-11. So some of the essential features we will see one by one. First is persistent deficit in social communication. That means impairment in the ability to understand and use language appropriately for social communication. Next is persistent deficit in social interaction. Some individual may exhibit limited social interaction due to shyness or behavioral inhibition, and these are not considered as indication of autism spectrum disorder because shyness and behavioral inhibition are different from the social interaction deficit. Some of the manifestations that may include limitation in understanding of the verbal and non-verbal social communication. And it includes reduced interest in verbal and non-verbal communication and inappropriate responses. Next is limitation in integration of spoken language with typical complementary non-verbal cues. For instance, facial expression, gesture, eye contact, and body language. Next is limitation in understanding and use of language in social context. Also, reduced ability to initiate and sustain reciprocal social conversation. Next is lack of social awareness or understanding leading to behavior that is not suitable for particular social context. That is being unaware of social norms. For instance, dancing and laughing in a library or quiet space. Next is reduced ability to imagine and respond to feelings, emotional states, and attitudes of others. Next is the limitation in mutual sharing of interest. And last manifestation that comes under point 1 is reduced ability to make and sustain typical peer relationships. Second point is persistent, restricted, repetitive, and inflexible pattern of behavior, interest, and activities. And these pattern of behaviors characterized by repetition, routine, or restricted interest are not by themselves indicative of autism spectrum disorder unless there is also evidence of impaired reciprocal social interaction and social communication. Some of the manifestations include lack of adaptability to new experiences and circumstances with associated distress that can be evoked by trivial change to a familiar environment or in response to anticipated events. Next is inflexible adherence to a particular routine, such as following familiar routes or may require precise timing such as meal time or transport. Next is excessive adherence to rules, especially when playing games. Next point is excessive and persistent ritualized pattern of behavior. For instance, preoccupation with lining up or sorting object in a particular way, but that serve no apparent external purpose. repetitive and stereotype motor movement, and that may involve whole body movement, for example rocking, a atypical gait, for example walking on tiptoes, unusual hand or finger movements, and posturing, and these behaviors are particularly common during early childhood. Next is persistent preoccupation with one or more special interest, objects and stimuli, or an unusually strong attachment to particular object. Hypersensitivity or hyposensitivity to sensory stimuli, and it is a lifelong, excessive and persistent, which may include actual or anticipated sounds, light, texture, especially clothing and food, odor, taste, heat, cold or pain. The onset of disorder occurs during the developmental period, typically in early childhood. The symptoms result in significant impairment in personal, social, educational, occupational, or other important areas of functioning. It is a lifelong disorder, the manifestation and impact of which are likely to vary according to the age, intellectual and language ability, and co-occurring condition and environmental context. Males are 4 times more likely than females to be diagnosed with the autism spectrum disorder. Now we will see some of the specifiers for characterizing features within the autism spectrum disorder. It includes 3 important specifiers. First is co-occurring disorder of intellectual development. It exhibits limitation in the intellectual ability. If no co-occurring diagnosis of the disorder of intellectual development is present, we will use the specifier as without disorder of intellectual development. And if there is a co-occurring diagnosis of disorder of intellectual development, we will use the specifier as with disorder of intellectual development. Next is degree of functional language impairment. The degree of functional language impairment, it might be spoken or signed, should be designated with the second specifier, and functional language refer to the capacity of the individual to use language for the instrumental purposes and not for the pragmatic language deficit. That is the core feature of the autism spectrum disorder, and it may include first specifier as with mild or no impairment of functional language, second specifier as with impaired functional language, and third specifier as with complete or almost complete absence of functional language. Next is 6A02.Y other specified autism spectrum disorder, 6A02.Z autism spectrum disorder unspecified. Now we will see the diagnostic codes for autism spectrum disorder. A represent without disorder of intellectual development. B represent with disorder of intellectual development. One represent with mild or no impairment of functional language. Second represent with impaired functional language. And third represent with complete or almost complete absence of functional language. The code 6A02.0 represent autism spectrum disorder without disorder of intellectual development and with mild or no impairment of functional language. The specifier 6A02.2 represent autism spectrum disorder without disorder of intellectual development with impaired functional language. The diagnostic code 6A02.1 represent autism spectrum disorder with disorder of intellectual development and with mild or no impairment of functional language. The diagnostic code 6A02.3 represent autism spectrum disorder with disorder of intellectual development with impaired functional language. And finally, the code 6A02.5 represent the autism spectrum disorder with disorder of intellectual development and with complete or almost complete absence of functional language. Next specifier is loss of previously acquired skill, and it typically occurs during the second year of life. And if it occurs after 3 years of age, it is more likely to involve loss of cognitive and adaptive skill, that is, loss of bowel and bladder control and impaired sleep. Next is regression of language and social ability, and it also involves increasing emotional and behavioral disturbances, and it may be represented as 6A02.x0 without loss of previously acquired skill, and next specifier is 6A02.x1 with loss of previously acquired skill. Now we will see some of the additional clinical features that are present in the autism spectrum disorder. First, in young children, intellectual and other developmental delays are present. For instance, problem in language and motor coordination. In middle childhood, there may be a prominent symptom of anxiety, including social anxiety disorder, school refusal, and specific phobia. During adolescence and adulthood, depressive disorders are often a presenting feature. Next, additional clinical feature involve pragmatic language difficulty, and it may be manifested as an overly literal understanding of others' speech or speech that appear monotonous or lack of awareness of the appropriateness of their choice of language in particular social context. Next is social naivety. It is especially during the adolescence can lead to exploitation by others and a risk that may be enhanced by the use of social media without adequate supervision. Next is self-injury is also present, for example hitting one's face, or some may develop epilepsy or seizures during early childhood. Catatonic state have also been described, and prenatal exposure to valproate is also associated with increased risk of autism spectrum disorder. We will see the developmental presentation as per the age. In infancy, we have to use the retrospective approach. True regression, if present within an onset between 1 and 2 years of age, is unusual but significant, and we have to use the specifier with loss of previously acquired skill. In preschool, avoidance of mutual eye contact, resistance to physical affection, a lack of social imaginary play, language that is delayed in onset, social withdrawal, obsessive or repetitive preoccupation, lack of social integration with peer, and sensory sensitivity to everyday sounds or to foods are present. Middle childhood presentations include resistance to engage in unfamiliar experiences. There may be marked reaction to even minor changes in routine, excessive focus on detail, and rigidity of behavior and thinking may be significant. Symptom of anxiety may become evident at this stage of development. In adolescent, presenting feature may be the depressive symptom. In adulthood, breakdown in domestic or work relationship is the presenting feature. Now we will see some practice question. First is, what does autism spectrum disorder ASD refers to? First, a single specific condition. Second, a range of neurodevelopmental disorders. Third, a mental health condition. And fourth, a physical disability. You have to answer in the comment box below. Next question for your practice is, what is the primary way that autism spectrum disorder is diagnosed? First, blood test. Second, genetic testing. Third, observation and behavioral assessment. And fourth is medical imaging. So you have to answer this question also in the comment box below. If you have any query regarding this video, or if you want any other video on any specific topic, please comment below. Thank you.